The CDC is saying that adolescents should not use e-cigarettes or vape. Certainly pregnant women should not, and individuals who are not smokers or tobacco users already should not start using e-cigarettes. Vaping essentially is the inhalation of different types of substances through an electronic device. We call them e-cigs or e-cigarettes. So essentially it's a liquid that you can put into the device that you inhale from, and there's some sort of heating element that then vaporizes the substance. The different types of chemicals that are included in the e-cigs or e-cigarettes, there can be a wide range of substances. Commonly we'll see nicotine, we may see different flavoring substances, and also we can see different substances that are components of marijuana, so THC or CBD. In general, anything that we inhale into the lungs could have direct toxicity into the lungs. More specifically, nicotine is a particular concern because it's a highly addictive substance.
There's been historically some issues with certain flavoring agents, but nothing as big as recently. They have it's called a vaping-associated pulmonary illness. So people get admitted to the hospital and they have respiratory symptoms and also some gastrointestinal. So usually they'll be nauseated, vomiting, have shortness of breath and things like that. But it could be to the THC or it could be to the oils that are in it. A lot of people commonly think that with vapes it's water in there, and it's not. It's a variety of components and a lot of it's oils. When those oils are heated up, they break into a bunch of other components. And that can be a problem because we don't know exactly what's in everything.
Essentially two different populations. One would be youth and adolescents, ranging even from middle school to high schoolers. There have been various studies and surveys that have gone out. Most recently, within the last few years, up to 20% of our high schoolers have used e-cigarettes or vaped, and that's even consistent within South Dakota. Another high population that are using e-cigarettes are patients that are smoking, individuals that are smoking. So the idea is, in theory, that they can use the e-cigarettes to try to help them stop smoking.
We wouldn't advise vaping as a safe alternative. It's not as safe as people thought, and it might be more dangerous than we initially thought as well.